So let's start in Bismillahirrahmanirrahim. In previous video, in last we talked about two things, which was actually functional and non-functional cusps. Let's moving towards in its detail. Okay, so the lingual occlusal line of the maxillary teeth and the facial occlusal line of mandibular teeth actually marks the location of functional cusps. So basically, they are saying actually. So you can see here this line, which is actually the lingual occlusal line of the maxillary teeth and the facial occlusal line of the mandibular teeth. These lines actually mark the that which one are actually the functional cusps. Okay. When the cusps come in contact with the opposing teeth in their corresponding, so they form actually a facial-lingual center. Okay, this is very important. On the marginal ridge means that the margins of the tooth, okay, or a fossa. Functional cusp central fossa contact has been actually compared to the motor and pistil. You have seen that how in a small ball that is made of actually sometimes from a very hard thing, and you have actually just pistil and then you have mortar. Okay, so because the supporting so the supporting cusps, what they do, they crushes and grind the fibrous food against the ridges, forming the concavity of the fossa. Okay, you can see here the pattern of cusps and a groove. Groove means this is considered a cusps, and this is considered a groove, and in between the food is crushing actually. So they give that this is a mortal pistil for crushing the food. Similar pattern. So basically they form a concavity of the fossa. Functional cusps, what they do actually, they prevent the drifting of teeth. Drifting of teeth is actually means when the migration of teeth happens from their normal position due to the towards that place where the tooth is actually missing, or there is any other disease or teeth grinding. It also prevents the passive eruption of teeth. So passive eruption actually mostly happen of the teeth when the where the gingival tissues moves apically, and that expose the tooth even after the active movement of the tooth into the mouth is finished. So the functional cusp prevent two things: the drifting of teeth, means it does not allow the teeth to move in those places where the teeth are already missing, or passive eruption of teeth. Hence they are actually known as holding cusps. So why they are known as holding cusps? Because they do not allow the drifting of teeth and passive eruption of teeth. Functional cusps can be identified as 5 characteristics. They contact the opposing tooth in. What they do, they contact the opposing tooth in maximum intercuspation, and they support the vertical dimension of face. They actually help to maintain that vertical dimension of face. They are actually near the facial-lingual center of the tooth than the non-supporting cusps, and their outer incline has the potential for contact. They have broader and more rounded cusp ridges than the supporting cusps.